Alright, we're going to give you a little tour of how to go through acute care. Swipe to get into the clinic. If you need to check in with cashiers, they are right there. And then our main acute care door. The main in and out door for acute care. There's a couple others that we can go in and out of. Oh yeah, we can use that. We've got 6 chairs in here. Of those 6 chairs, similar to the old school. Pick a chair and set it up. This is what we want the chair to look like when it is done for the day. Cleaned, ready to sit overnight, turned off. To turn your chair on, there's a little switch right here. Turn that over. That turns on your electric handpiece. If you turn that off, you hear that it depressurizes and turns it off. So to turn it on, go there. You can move out your bracket table. Notice that the bracket table won't push down. If you want to have it in a downward position in some way, there's a little lever right here under the handle. Click that, go up just the tiniest bit, you hear that release, and you can move it down for the shorter folks. You can always move it up, but you can hear that ratcheting. It won't go down unless you release it here. You've got air water syringe, a air-driven slow speed, air-driven high speed, and electric handpiece. We'll eventually move to the electric handpiece, but for now, right now in acute care, we're using the air-driven handpieces until everyone has had training with the electric handpiece. You've got your normal bracket table here. The little button right here on the side will get you into the controls for the 4 hoses. We do not want you messing with those. If you need to mess with those, talk to someone. We don't want to mess anything up in there. Also be careful, if you pop that open, you can pop your instruments off the bracket table. If for some reason that button is not pushing in, there's a little screw that needs to be loosened there. When you have your patient in the chair, obviously you're not going to have them this high. If you press number 1 right here, it's preset. All of the chairs in here, all 6 of them are preset. Number 1 is in and out of the chair. So patient sitting down, patient getting out of chair, so you can just press 1 and move it. Press 2 is your working position. Now be careful, if you are moving the chair around, this can get underneath your bracket table. If you have that underneath for some reason, say we move the chair down a little bit, you're underneath there and then you press it up, you are going to break this and break this. That doesn't work out well. So be very, very careful of that when you're moving the chair around, especially if you're not using the manual controls. So back to number 2 is your working position for the most part. You're going to have to adjust a little bit. If you are doing surgery, move on to chair position number 3. Let's say we're working on a patient here. You want to use the light. We've got several controls. Left control turns on the light. If that little green button is lit up, that means the arrow moving down. If you press or pull down, it turns on the light. If you pull back up, the light will turn off. So you do not need to have anything back here to make the light work. You don't actually really need to change anything on here while you're working on it. You just need to pull down and the light will turn on. That being said, you can push it again. That green light goes off. This green light goes on, which means that's going to be on all of the time, regardless of if you move it up and down. Over here, you can change the intensity. Those 3 green indicator lights will change the intensity. If you want the composite filter on, press the middle one, composite filter off. There we go. So this is on 100% of the time now. You want to turn it off, just press that left button. Looking back at the computer, we've got main screen, which should be your Axiom, things of that nature. If we have any sort of x-rays up, they will be able to go over to that screen. You can't move it unless it's been minimized. So that will show up on that 3rd computer. So if you have any sort of x-rays up, you can have them on 2 computers. When you are done with the computer, you go down to the bottom left corner. You do not press power button. You go up to the little indicator that has a person profile, and click on that and hit sign out. A couple other things. Nitrous is a tankless system, different from the old school. There's a separate video on that. We have gloves sitting in here. If you need mask, patient napkin in here, some supplies here, some supplies here, some supplies there. Those will be restocked as needed. We have a couple triturators. They're throughout the clinic. The garbage, very, very, very small. There's not a lot of space in there because of piping. We want you to take a headrest cover and tape it right here and use that for your trash. When you are done with your appointment, bag that up and include that in doing your getting your instruments back to sterilization. Sterilization, get all of your instruments over from dispensing, but when you're done with instruments, used instruments, we won't call them dirty, used instruments will be placed in here and that will be taken care of by the sterilization folks. Sink. Turning the sink on, pretty easy. Touch there, turns it off. This has to be on, it's a little touchy. This has to be on for the touchless or the motion sensor. This little blue light down here is the motion sensor. See, little touchy, it doesn't work always, but you can go with your wrist, elbow, etc. so that you're keeping your hands clean. Paper towels, when they're in there, we just use the last ones, will be in there. We can show you over here what it looks like. Right there. Other than that, when you're done with your patient for the day, done with the surgery, press 4. That will give you the height that's able to be cleaned around. Clean everything up. Place your hoses in the right spot. Make sure that it's depressurized and you turn it off. And you're good to go.